All right, so today we're going to really dive deep into EMDR,
Okay.
eye movement desensitization and reprocessing.
Okay.
And I think the way to think about it is how our brains work when it comes to processing information, and especially when we've had some kind of challenging or even traumatic experience.
Right. Yeah.
So how do we process that information and really integrate it?
Yeah, absolutely.
And what I think is so interesting is that it's not just one school of psychological thought. It's like this real integration of,
Absolutely. It's eclectic.
yeah, a lot of different therapies.
It draws from so many different perspectives, cognitive approaches, which look at thoughts and beliefs, and behavioral techniques that focus on actions. And then also you've got the psychodynamic lens,
Yeah.
which delves into those deeper seated patterns. And of course, somatic approaches
Right.
that acknowledge the crucial role our body plays in all of this.
It's very holistic in its
Way-
thinking.
Very much so. It's a very holistic way of supporting the brain's natural healing process.
Right. So for our deep dive today, we have a ton of writing on this subject.
I do.
And we're going to be talking about different EMDR protocol
Oh,
and the techniques
yes.
that are used in different situations.
Right.
But, and this is important, I think, for listeners,
Yeah.
these are not just formulas that are kind of
Yeah.
set in stone.
No, not at all.
These are really adapted by clinicians
Exactly.
based on the needs of each client
Absolutely.
and the situation.
Yeah, and that's what makes it so dynamic and adaptable, right?
Right.
It's not a one-size-fits-all approach at all.
So to understand like the depth of this material,
Yes.
we need to acknowledge some of the key figures in this space.
Absolutely.
So of course you have Francine Shapiro, who developed EMDR,
Yes.
but you also have Marilyn Luber,
Oh, absolutely. She's fantastic.
who wrote the handbook for EMDR clients.
Yeah.
And
Which is very accessible, by the way,
yeah.
for anyone who's interested in understanding this more deeply.
Yeah, and she was a big contributor to many of the protocols that we
Tools.
talked about.
Right.
We also have Roy Kiesling,
Yes.
Brewitt Lobb,
Yes.
Alain Shapiro,
Mm-hmm.
David Bloor,
Right.
Lucina Artigas,
Yes.
and Ignacio Ferrero.
Yeah, and all of these folks, have really extensive experience in the field.
Right.
In areas like trauma recovery,
Yep.
working with communities after disasters,
Yeah.
individual therapy.
Crisis response.
I mean, it really shows you how broadly applicable EMDR is.
Yeah. So our mission for this deep dive
Okay.
is to really extract, like, what are the key insights
Absolutely.
about how EMDR is applied
Yeah.
in all these different situations.
Right.
And give you a clearer understanding of, like, just how versatile
Right.
and profound this therapeutic approach can be.
Absolutely. It's fascinating stuff.
Okay, so let's unpack this.
All right, let's do it.
Let's start at the beginning.
Okay.
How do EMDR practitioners take a client's history?
Right. Okay, so getting a really thorough understanding of your history is absolutely essential. It's the first step in EMDR.
Yeah.
And a really common framework and a very helpful one is this idea of the three-prong approach.
Okay.
Have you heard of this before?
Yeah.
Okay, so it looks at, past events that might be fueling the current difficulties.
Okay.
It looks at what triggers you in the present,
Mm-hmm.
and it also considers future goals.
Mm-hmm.
So what do you want to experience? What do you want your life to look like moving forward?
Right.
So it's a very holistic perspective
Yeah.
that really sets the stage for everything that follows.
So a specific technique that's used here is the timeline script,
Yeah.
developed by Arne Hoffman and Marilyn Luber.
Yeah.
How does that help in understanding someone's history?
Okay, so the timeline script is really about bringing important historical information to light in a very structured way.
Okay.
So you might be asked to think about and list your best and worst memories. And you'd note the age at which those memories occurred.
Okay.
And importantly, you would also rate the initial subjective units of disturbance.
SUDs.
Yes, exactly,
Gotcha.
SUDs. And that's basically a scale from 0 to 10
Okay.
that indicates how distressing that particular memory feels to you right now.
So it's like a visual representation of, like,
Exactly. It helps you organize your life events
Okay.
and see some patterns
Yeah.
emerging.
and then how do practitioners decide, like, what to target?
Right, so the targeting sequence.
Yeah.
Yeah, so there are different approaches to this.
Okay.
Sometimes we might do what we call simple treatment,
Okay.
where we really focus on a primary symptom.
Okay.
This can be really helpful when therapy is more time limited.
Right.
On the other hand, we have comprehensive treatment,
Mm-hmm.
and this is where we address multiple interconnected issues,
Okay.
and it naturally takes place over a longer period of time.
Right.
So planning the sequence is crucial.
Okay.
It ensures we process things effectively. I've seen that mentioned the float-back technique and the effect scan.
Oh, yes. Those are great.
How do they help in figuring out what needs to be targeted?
Okay, so both of these techniques are about identifying earlier life events
Okay,
that might be driving your current struggles.
right.
So with the flowback technique, let's say you have a disturbing image in mind,
Mm-hmm.
and a negative thought that's
Yeah.
connected to it.
Yeah.
And you just allow your mind to drift back to the earliest similar experience you can remember.
Okay.
Now, the affect scan, which is adapted from the affect bridge,
Okay.
is really focused on the emotion.
Okay.
So you zero in on how you're feeling about a present issue
Yeah.
and just see where it takes you, connect it to earlier times. You felt the same way.
Interesting.
Yeah,
So it's like tracing it back to like when it first happened.
exactly.
But I also saw caution
Yes.
about using these during history taking.
Yes, that's so important.
Why is that?
Because during history, taking the goal is identification.
We don't want to go into full-blown processing at that point.
Right.
It could be too overwhelming,
Right.
We proceed gently, always mindful of the client's comfort level.
What if you don't have like a clear, dominant negative belief?
Okay.
How does a practitioner decide then?
So in that case, we might use what's called issue or symptom-focused clusters.
Okay.
So instead of focusing on a belief,
Mm-hmm.
we look at the most prominent issue.
Okay.
It could be an emotion, a sensation,
Yeah.
a trigger, like a smell or a sound,
Right.
even a specific person or place
Right.
that consistently causes distress.
So you target the most like obvious
The exact
source of disturbance, even if it's not like a
even if it's a
verbalized belief.
fully formed belief, yeah.
Right. And what's the significance of a touchstone event in all this?
Okay, so the touchstone event is often considered the earliest experience.
Okay.
That really laid the groundwork for the current issues.
Okay.
While processing other incidents can help addressing this root event. Okay.
Can sometimes be key to a more complete treatment.
It's like the initial encoding,
Exactly.
the traumatic memory network.
Right. And by updating that core memory,
Right.
you create a ripple effect that impacts later experiences.
That makes sense. So getting to the root.
Exactly.
Now, one of the sources talked about the multi-tiered transgenerational genogram, or MTTG.
Oh, yes. The MTTG, that's a mouthful, isn't it?
Yeah.
But it's a fascinating tool.
So what's the purpose of using that?
Okay. So the MTTG helps us understand patterns
Okay.
of reactions and experiences that might have been present in your family system
Right.
across generations.
Okay.
It's particularly helpful when understanding the context of crisis situations.
Oh.
So we're talking about mapping out your family history,
Okay.
birth dates, cultural backgrounds, behavioral patterns,
Yeah.
and any known traumas.
Mm-hmm.
Essentially, we want to see if there are any patterns of trauma or resilience
Interesting.
that have been passed down.
Wow.
Yeah, it gives us valuable context for the current issues. What kind of questions would a practitioner ask then?
Oh, they might ask about how your family celebrates important events.
Okay.
What traditions or patterns have been carried through generations,
Yep.
how the family has dealt with difficult or traumatic events,
Okay.
and about any significant historical occurrences,
Okay.
like wars, natural disasters, migrations that might have affected your family.
Right.
We might also look at important dates,
Mm-hmm.
even instances of name changes,
Wow.
because sometimes those can hold significant information.
That's fascinating. So it's really a way to see...
With the bigger picture.
Yeah.
Absolutely.
Okay, so we talked about taking history
Yes.
and identifying what to target.
Right.
Now let's get to like the core of EMDR,
Right.
Adaptive Information Processing, or AIP.
Yes, AIP.
So what exactly is happening there?
All right, so AIP is really the foundational theory of EMDR.
Okay.
It suggests that our brains have this incredible natural ability to process information
Yeah.
and integrate it with our past experiences in a way that promotes healing. Right. Think of it like your brain has a filing system
Okay.
for memories.
Yeah.
But sometimes trauma can disrupt this system,
Okay.
leaving certain memories stuck
Yeah.
with all the intense emotions, beliefs, and physical sensations
Yeah.
that were present at the time.
Right.
EMDR aims to reactivate this natural processing,
Okay.
helping your brain properly file those memories
Right.
so they don't cause distress anymore.
It's like updating the story.
Exactly.
So when someone goes through trauma,
Yeah.
the brain's normal way of dealing with it.
It gets disrupted.
Yeah.
The memory might be stored in a fragmented way,
Right.
like pieces of a puzzle scattered about,
Right.
along with all those strong emotions,
Yeah.
negative beliefs, and
Right.
physical sensations.
Right.
And EMDR helps put those pieces back together.
Helps facilitate the connections.
Exactly.
Now, accessing those negative cognitions can be tough.
Right.
I saw that metaphors are used to help with this.
Oh, yeah. Metaphors are powerful because they provide a gentler way to access these deep-seated beliefs.
Right.
For example, a therapist might use the metaphor of baking a cake
Right.
and realizing a key ingredient is missing,
Yeah.
to illustrate that even seemingly small or overlooked aspects of an experience need to be acknowledged
Yeah.
for the whole to feel complete.
Interesting.
They might also talk about different parts of yourself
Yeah.
or parts of the brain that need to work together more harmoniously.
So making it more concrete.
Exactly.
Now, I also saw reference to the lion in the room concept.
Oh, yes, from Why Zebras Don't Get Ulcers.
Yeah. How does that relate to EMDR?
Okay, so the lion in the room is this great metaphor for how our brains are constantly scanning for threats.
Okay.
Even subtle cues, a smell, a sound, an image,
Yeah.
can trigger a memory of past danger,
Wow.
even if the danger isn't actually present.
Right.
So for someone with trauma, these sensory inputs can act like that lion,
Wow.
triggering a stress response
Yeah.
and reactivating the unprocessed memory. Yeah.
Bringing the past into the present.
Exactly. And identifying those lions,
Mm-hmm.
those triggers, is a key part of EMDR therapy.
So recognizing those often unconscious cues.
Yes.
Now, EMDR isn't just about processing the negative, is it?
No, not at all.
Resource development seems to be a huge part of it as well.
Absolutely, building resources.
Yeah.
Things like safety, calm, strength connection.
Yeah.
Is crucial,
Yeah.
especially when working with recent trauma or with children.
Okay.
We want to create this solid foundation of inner support
Okay.
and coping skills
Yeah.
to navigate the difficult emotions.
Right. And there were a few specific techniques mentioned, the butterfly hug,
Yes.
group protocol.
Right. So the butterfly hug, developed by Lucina Artigas and Ignacio Guerrero, is a beautiful self-soothing technique.
Yeah.
You cross your arms and gently tap on your upper arms or shoulders,
Okay.
alternating sides.
Yeah.
It mimics bilateral stimulation and can be very grounding.
Yeah.
Now, the Group protocol by Bruitt-Laub and Esti Barsaid is often used with children who've experienced trauma.
Yeah.
It helps them connect with feelings of safety and support through guided imagery and bilateral stimulation.
So those resources are so important.
They are the foundation.
Now, we also saw the safe, calm place protocol.
Oh, yes, that's a classic.
That seems like fundamental resource to have.
It is, it was inspired by Dr. Neil Daniels, and it's really about creating a sense of inner sanctuary.
Yeah.
So you imagine a place where you feel completely safe, calm, and peaceful.
Okay.
We engage all your senses. What do you see, hear, smell, feel?
Right.
To make it as vivid and real as possible.
And this is a place that you can go back to
Absolutely.
during or after processing.
Anytime you need to regulate your emotions,
Okay.
find that sense of calm.
Now, there's also the 4 elements exercise for stress reduction.
Yes.
How does that work?
Okay, so the 4 elements exercise is all about shifting your attention outwards
Okay.
and grounding yourself in the present moment.
Okay.
So you identify 3 things you can see,
Mhm.
2 things you can hear, 1 thing you can smell, and 1 physical sensation.
Just
It's a simple but effective way to engage your senses.
right.
Some practitioners even use a bracelet or another small object
Okay.
as a physical anchor to enhance this grounding.
So it's consciously bringing yourself back to the here and now.
Exactly.
But what about situations where it's difficult to establish a safe place? The idea of the fear of the fear.
Yes, for some people, especially those with complex trauma,
Right.
even imagining a safe place can be triggering.
Right.
So in these cases, we shift the focus to any positive experiences,
Okay.
people or objects they can recall.
Yeah.
It might seem small,
Yeah.
but it's about gradually building that foundation
Yeah.
of positive associations.
And then there's extending resources by Roy Kiesling.
Yes.
How is that different from the safe place?
Okay, so a safe place is more about a general feeling of calm.
Okay.
Extending resources focuses on specific inner strengths and skills.
That's acting.
Exactly. It's about identifying and strengthening those qualities.
Right.
You need to cope.
Okay.
So we might use bilateral stimulation to enhance your connection to a feeling of confidence, resilience, or compassion.
And then rehearsing using those.
Exactly. We practice using those resources
Okay.
in anticipated situations.
So it's like building your capacity to cope.
Precisely.
And what about the resource connection envelope, or RCE?
Ah, yes.
Maybe
By Bruitt-Laub.
So the RCE emphasizes the interplay between negative memories and positive resources.
Okay.
We're essentially strengthening the connection between them
Mm-hmm.
to create a sense of balance.
Okay.
So we use bilateral stimulation along with verbal and somatic cues
Okay.
to access the chosen resource,
Yeah.
while briefly bringing the negative memory into awareness.
Okay.
The idea is to allow those positive feelings to envelop and modify the negative experience.
Interesting.
Yeah, so it's all about integration,
Right.
creating a more balanced internal landscape.
Mm.
Okay, this has been a really good overview, I think, of the fundamental aspects of EMDR.
It has.
So now let's look at how these principles are applied in specific situations,
Oh,
because there are a lot of different protocols.
there are.
Let's start with the EMDR drawing protocol for adults.
All right.
Why drawing?
Okay, so this protocol developed by Esli Regina Carvalho is great for people who find it hard to describe a scene
Okay,
or image related to their trauma,
right.
but they have a strong negative belief associated with it.
Yeah.
So the drawing becomes the visual representation of what we're targeting.
So the drawing is like the target.
Exactly.
Right.
It provides a focus when words fail.
That's really interesting.
Yeah.
Okay, so then what about the image director technique for dreams?
Oh, yes. This one's by Tanis Freja,
Okay.
and it's a more active approach to nightmares.
Okay.
Instead of just replacing negative dream content with positive imagery,
Mm-hmm.
we actually have you imagine the worst possible outcome of the dream. And then using bilateral stimulation, you actively direct the imagery toward a more positive resolution.
Wow, that's interesting. So you're like rewriting the ending.
Exactly. It's about taking control.
Wow. Okay, so when it comes to single traumatic events,
Yeah.
is there a specific protocol for that?
Well, for single events, we usually follow the standard 8-phase EMDR protocol.
Okay.
The key is to clearly identify the initial memory,
Okay.
the negative belief,
Right.
the desired positive belief,
Okay.
and the feelings and sensations that come up.
Right.
Then we go through the desensitization, installation, body scan, and closure phases.
Right, right. And what about for more recent traumas?
Right.
There's the recent traumatic events protocol.
Yes. The RTT developed by Elon Shapiro and Brewer-Lob.
Okay, so how is that different?
Okay, so RTT is an early intervention protocol
Okay.
designed for use soon after a traumatic event.
Mm-hmm.
It addresses the recent past, the present impact,
Yes.
and future concerns.
Okay.
The cool thing is processing targets within the T episode.
The TF.
Yeah, meaning the traumatic event itself can happen non-sequentially.
Yeah.
You can jump between different aspects,
Interesting.
processing at both micro and macro levels,
Okay.
and they use a tool called the episode narrative and initial Google search script
Okay.
to identify those targets.
So it's more flexible
Much
for
more.
recent trauma.
Exactly. It acknowledges that those memories might not be fully formed yet,
Right.
and we need to be more fluid in our approach.
Now, this one sounds really specific. The underground trauma protocol.
Ah, yes, by David Bloor.
What is it about underground trauma?
So underground trauma, like that experienced by minors,
Right.
presents some unique challenges.
Yeah.
There's often a deep sense of violation related to the damage or instability of the underground environment,
Yeah.
which is often seen as a contained and safe space.
Yeah.
There's also the risk of dehydration,
Yeah.
the intense experience of witnessing others' anxiety
Yeah.
in a confined space.
Right.
And even changes in smells, which can become powerful triggers.
Interesting.
So the protocol includes specific questions
Okay.
to explore these nuances.
And is there a certain order for targeting underground memories?
Yes, there is.
Okay.
We often start with memories associated with heat,
Okay.
followed by darkness,
Right.
and finally disorientation.
Okay.
These are often the most distressing sensory element.
Yeah, that makes sense, focusing on those.
Exactly.
Now, there's also the railway experience.
Yes.
That sounds intriguing.
It's formally titled Being in Control, the Non-Disclosure of Traumatic Memory Content, and EMDR.
Wow.
It's for professionals in high responsibility roles,
Okay.
like train engineers or pilots,
Right.
who might have experienced trauma but need to maintain confidentiality.
Right, because of their job.
Exactly.
So they don't have to disclose the full memory.
Not necessarily.
How does that work then?
So we use a technique called morphing the image
Okay.
instead of focusing on the explicit image. We have them stretch, distort, or morph it into something less threatening.
Okay.
This allows us to process the emotional charge
Right.
without requiring full disclosure.
That's really clever.
It is.
Then we have the EMDR Accelerated Information Resourcing Protocol.
Yes, EMDR AIR
And it's for early intervention.
Exactly. It's designed for acute trauma situations,
Okay.
like in an emergency room.
Yeah.
The focus is on rapidly establishing safety
Okay.
and helping them create a coherent narrative.
Okay.
We use bilateral stimulation even if there's a language barrier,
Wow.
because it can facilitate grounding even without extensive verbal processing.
It's about that immediate stabilization.
Exactly.
Right when it happens.
Right.
And I also saw protocols for excessive grief and illness.
Yes.
So how can EMDR help in those situations?
Okay. So with excessive grief, EMDR helps individuals accept the loss
Okay.
and integrate both positive and negative memories of the deceased.
Yeah.
The goal is to reach a place where they can remember their loved one without being overwhelmed by grief,
Right.
and to move forward
Right.
for illness and somatic disorders.
Yeah.
EMDR addresses fears, anxieties,
Right.
and past experiences that might be contributing
Right.
to the condition.
Okay.
Techniques like the light stream technique,
Yeah.
points on wall or room, and index fingers
Yeah.
can help process those physical sensations and emotional distress.
That's interesting because EMDR can really address those emotional and psychological components
Absolutely.
that go along with those physical challenges.
They're often intertwined.
And then there's also protocols for enhancing positive emotions
Yes.
and performance.
This is a fascinating area.
It is. It's like a really different application of EMDR.
It is the work of John Hartung.
Yeah.
Really explores this. He shows how EMDR can be used for positive psychology
Okay.
and performance enhancement.
Yeah.
It's about achieving goals,
Okay.
strengthening positive qualities,
Right.
and fine-tuning skills.
Okay.
We focus on how language shapes behavior. Interesting.
Explore memories of success and failure.
Mm-hmm.
Identify hot words that trigger negative states,
Right.
and then process those triggers with EMDR.
Okay.
We also integrate things like diaphragmatic breathing
Okay.
and focusing on cardiac coherence.
So it's not just about overcoming negative experiences.
No, it's about optimizing positive ones.
Reaching your full potential.
Exactly.
And there's the EMDR Performance Enhancement Psychology Protocol.
Yes.
How does that build on this idea?
Okay, so this protocol provides a framework for using EMDR for performance enhancement.
Okay.
It guides us through exploring performance goals,
Mm-hmm.
past difficulties,
Right.
and internal and external distractions that hinder success.
Yeah.
And we have this amazing resource called Creating the Inner Advisor.
Okay.
It's all about developing a supportive internal voice
Yeah.
that guides you towards success.
With your own internal coach.
Exactly.
Wow. And of course, all of this requires a lot of self-care for the practitioners. Absolutely. It can be emotionally demanding work.
Yeah.
So self-care is crucial.
Yeah, the sources mention self-care for EMDR practitioners.
Yes.
And the Clinician Awareness Questionnaire in EMDR.
Right. So the questionnaire helps practitioners identify their own triggers
Okay.
that might be activated by client material.
Right, right.
And we have specific self-care BLS techniques.
Okay,
We might briefly bring to mind the image of the client,
okay.
maintaining confidentiality, of course,
Right.
and focus on a positive cognition for ourselves,
Okay.
using bilateral stimulation to process any vicarious impact.
It's so important to take care of yourself when you're doing this work.
It is.
So finally, we have the future template and the running a tape technique.
Okay, so the future template focuses on ensuring that the positive changes from therapy extend into the client's future.
Okay.
So we have them mentally rehearse how they'll cope in future challenging situations,
Yeah.
reinforcing those positive changes.
Right.
Now, running a tape is a method for identifying any remaining unprocessed material.
Okay.
You mentally review the event like you're watching a videotape.
Mm-hmm.
And we use bilateral stimulation to process any disturbance that comes up.
So it's making sure that even subtle reminders are addressed.
Exactly. We want to make sure the healing is thorough.
This has been such a comprehensive look at EMDR.
It really has. EMDR is such a versatile approach
It is.
with so many applications.
And this deep dive really just scratched the surface.
It did.
There's so much detail and consideration involved.
Absolutely.
And it's so important to remember
Yes.
that proper training
Yes.
and clinical expertise
Crucial.
are absolutely essential.
These protocols are powerful tools.
They are.
And they need to be used responsibly
Right.
by trained professionals.
So for our listeners,
Yes.
now that you have a broader understanding
Mm-hmm.
of how EMDR is applied
Yeah.
in all these different contexts,
Right.
maybe it would be interesting to explore further resources.
Absolutely. There's so much out there.
Yeah. Or even think about how these principles
Yes.
of information processing,
Right.
how we all integrate new knowledge and experiences,
Yeah.
how that relates to your own life.
It's fascinating to think about how our brains work.
It is.
You know how we process and store information and what happens when that process gets disrupted.
Right.
It can offer us so much insight into our own patterns and our potential for healing.
Right. So here's a final thought for you.
Okay.
As you think about the brain's ability to heal and adapt,
Yeah,
which we've really seen with EMDR,
absolutely.
what stuck information or limiting beliefs
Hmm.
might you consider reprocessing
Wow.
in your own life to move forward with more clarity and resilience?
That's a powerful question.
It is.
Thanks for bringing that up.
Well, thanks so much for taking this deep dive into EMDR with us.
It's been my pleasure.
It really has.